Ladies and gentlemen, to give you the welcome, we will transmit a video of Mr. Rafael Parente, who is from the primary care in the Ministry of Health. We receive all the countries that are part of the Dietary Guidelines. Ours for the Brazilian population is recognized internationally, and that's why it serves as a parameter of many other countries. We also know how much good nutrition, good food has a great effect in terms of prevention of diseases and in promoting health. The Ministry of Health, the government of Brazil, the Director for Promotion of Health of the Ministry of Health have done a very strong work in terms of promoting health, always focused on food and nutrition that is healthy. We hope that this meeting involving various countries and various countries that recognize international institutions like FAO and the World Health Organization, that they recognize the importance of our dietary guidelines for the population and dietary guidelines for the younger children, always based on scientific evidence and recognized internationally, and that it serves as a parameter for other countries. It is important the presence of others, that this be a productive meeting so that we might continue to find new solutions and improve our guidelines and the nutrition of the Brazilian population and of the whole world. Thank you, Mr. Rafael. We'd now like to invite Mrs. Luizete Bandeira, consultant of the Pan American Health Organization in Brazil, to give you the welcome. Hello, all. I'd like to greet Dr. Rafael, who sent this video, and my colleague from FAO in Brazil, Mr. Rafael Zavala. I'd like to thank all of you, your presence, especially from the countries, our panelists, our colleagues in FAO, which is our partner for the Decade in Action for Nutrition of the United Nations. It's a pleasure to be here to talk about scientific evidence in terms of food processing. The various forms of bad nutrition, malnutrition, obesity, or other, they exist in every country, in many communities, and sometimes in the same municipality. And these forms of malnutrition are connected. While hunger is still a problem, obesity and overweight has increased globally, especially those of low or medium income. The region of the Americas has the highest rates of obesity and overweight of the world. 60% and 30% of 60% of adults and 30% of children are overweight.
Bom, então a gente tem aqui na região das Américas.
So we have in the Americas the highest rates of overweight and obesity, and these rates in Brazil are high as well. Over 60% of adults are overweight or obese. Ultra-processed foods is one of the greatest factors, risk factors, like diabetes, hypertension, and having these products available have been increased in the world, especially in Latin America. So the consumption of ultra-processed foods has increased during the pandemic. To coordinate efforts at the global level with an effective participation of the countries to avoid all forms of bad nutrition in an ample way, 2016, the Assembly of the UN declared the Decade for Action for Nutrition. OPAS, PAHO, WHO, and others have worked for the better of more healthy nutrition. In 2017, it was the first country to formalize their commitments in this action and leads networks for actions and with these commitments. So due to trajectory expertise and the results reached in terms of strategy and cardiovascular problems and food, school food. So these guides in the level are very important for healthy guidelines and effective public policies to develop more healthy environments. Recently, there was an update of these guidelines in schools based on Brazilian dietary guidelines. There were limits for ultra-processed and to increase in natura food to students in public schools in Brazil. In Uruguay, they were the guide for healthy foods and nutritional labeling of these foods. The number of countries growing that are setting up these guidelines in terms of food processing, and there is increased evidence of the impact of this processed food on people's health all over the planet. And in these 2 days, we will have the opportunity to dialogue about these evidences and on the implementation of dietary guidelines in the region. This cooperation work will contribute to reach our commitments during this decade and consequently to improve the nutrition of the population in the Americas. I'd like to thank you all, and I wish all of you a good seminar.
Ok. Obrigado, senhora Luizete. Agora, para dar as
Thank you,
boas-vindas,
Ms. Luizette. Now I'd like to invite to give the welcome Dr. Rafael Zavala, representative of the Food and Agriculture Organization, FAO, in Brazil. Mr. Zavala, good morning. It's a great satisfaction to be here on these actions as regards dietary guidelines. I'd like to leave my special greetings to the Mr. Rafael Câmara of the Ministry of Health and to the consultant. And I'd also like to greet our other colleagues that are participating this event, not only in Brazil, but all other countries that are part of this regional network that will be present today and tomorrow. Argentina, Canada, Chile, Ecuador, Paraguay, and Mexico coming to FAO to work in terms of food security, and it's important, especially through the perspective of consuming more in natura food, minimally processed, and finding a balance to have a more awareness in what food is being consumed. And this year specifically, it's even more urgent due to three main motives. The first is that the pandemic has been a problem not only to the health system, but the food networks or economic systems. Almost 50 million Brazilians started to be in a situation of food insecurity and had to reduce not only the quantity but also the quality of the foods consumed. This data concerns us more when we think that 40% of Brazilian families have started to consume more processed food. And the second reason is that 2021 is the year for fruits and vegetables, and 4 million deaths in the world are related to the insufficient consumption of fruits and vegetables. And due to the pandemic, this number might become even greater. And family agriculture is responsible for most of the production of these foods. And when we consume more fruits and vegetables, we are valuing small producers. So we have to prioritize local foods with short travel times, not only for human health, but also the health of the planet, especially as regards carbon emissions. And the third reason is that we're only 4 years from the end of this decade for action for nutrition that will end in 2025. And my colleagues from WHO and FAO will talk about this a little bit. And more than ever, we need that all member states should work in sustainable food systems that promote varied food, that are healthy, and that contemplate a wide range of foods and more in natura and minimally processed. And an additional point, and that on the 29th of September, we will celebrate the International Day for Awareness of Waste or Food Waste, especially in fruits and vegetables. And fruits and vegetables require special attention, especially in a world where 22% of food is lost every year. Besides the joining of government, dietary guidelines have to be taken on by society for a real change in the culture, not only at homes and in the schools. And I'd like to reinforce once more that we're in an unusual situation of our history where we can see what are the main gaps of our systems, and they create an opportunity to advance against all kind of malnutrition so that we can go towards a more healthy lifestyle, better production, better environment, and better quality of life. Thank you very much for the invitation and have a good event. Thank you, Dr. Zavala, for your participation. We request all of you that turn off your microphones so you don't interfere in the event. Now we'd like to invite Dr. Lina Marie from FAO, who will give our speech on the Decade on Action for Nutrition from the UN. The meeting about food systems and the paths for the member states might end malnutrition.
Thank you very much. I hope you can hear me. I will switch off the translation here. Can I get a thumbs up that you hear me? Okay, good, thank you. And I will also start sharing my screen, and maybe to reduce bandwidth, I will stop sharing my video, but I hope that you will continue to hear me. And I'm now sharing my screen. Can I have a thumbs up that you, okay, fine, great. So thank you very much to the organizers to invite WHO to speak today in this very important Food Systems Summit to provide a little bit of a perspective with regard to your work, how it is linked to global commitments. And what I will want to show is that definitely your work is relevant, it is needed, and it supports global commitments. It's not just coming out of the blue, your work. And also what I think is interesting is to find real similarities between the work of the Decade of Action on Nutrition, which was proclaimed in 2016, and the Food Systems Summit itself, with regard to action areas, commitment making, action networks, and coalitions. There's quite a lot of similarities there. So just in this slide, we have a number of important events and global commitments that were taken. And I just want to highlight a few. We have the Global Nutrition Targets, which were adopted in 2012 by the World Health Assembly. The year after, the Global Targets on NCDs. Then we had the International Conference on Nutrition in 2014, and then the proclamation of the Decade of Action in 2016. And now to 2021, we are in the year of action on nutrition, where we have two important summits that are taking place. One just happened, the Food Systems Summit happened last week, and the upcoming also Nutrition for Growth Summit organized by and hosted by Japan, which will happen on the 7th and the 8th of December. So first, let's have a quick look at the second International Conference on Nutrition, which happened in 2014, which was co-organized by FAO and WHO, because this conference was also 2 years in the preparation and led to two important outcome documents: the Rome Declaration on Nutrition, which has a number of voluntary commitments included in the text, and its accompanying framework for action, which has 60 policy recommendations for implementation of the political commitments. So especially the framework for action with its 60 policy recommendations, if you read it now, although it happened in 2014, it's still so very relevant and so useful and multi-sectoral, because the policy recommendations deal with sustainable food systems, international trade and investment, nutrition education, social protection, health system delivery of nutrition interventions, water and environmental sanitation, safety, AMR, and governance. I think somebody is not muted. Anyway, I will continue. So just to show that the recommendations are absolutely still relevant today. And I want to particularly, with the reference to this important action network, refer to 3 policy recommendations of the ICN2 framework for action, which is recommendation 13, 16, and 19. And you can read them here, which are specifically referring to dietary guidelines, and so your work. And I will come back later to these recommendations. So, of course, then in 2015, the SDG Agenda 2030 was adopted, and also some of the targets, the global nutrition targets, are integrated in, for example, the SDG 2, but I will not go into detail of that. Then, of course, one of the recommendations actually of the ICN2 Rome Declarations says that member states are encouraged to proclaim a decade of action on nutrition. And in fact, some countries led by Brazil actually took this very seriously and started to work on a draft resolution, brought together member states and organized the negotiations in New York, which then led to actually the adoption and the proclamation of the Decade of Action on Nutrition, a resolution which was co-sponsored by 30 member states. And so, I mean, I think most of you know about the Decade of Action on Nutrition, which tries to accelerate the implementation of the ICN2 commitments. So where the ICN2 commitments were voluntary and not really smart in the sense that there was not a deadline or a timeline in the commitments, the Decade of Action now provided a time frame to realize the ICN2 commitments. So the ICN2 commitments are like the fundamentals for the Decade of Action to take action. The Decade of Action is co-led by WHO and FAO, but of course it's member state driven, and it absolutely contributes to the achievement of the 2030 SDG agenda. The Secretariat of the Decade of Action, which is comprised of FAO, WHO, some other UN agencies, including UN Nutrition, also developed a work program. And that work program really emphasizes action and not just advocacy. And the work program also has identified 6 action areas that you can see on this slide. And I'm particularly drawing your attention to action area 5, because the ICN2 60 policy recommendations have been put into houses of the different action areas. And the ones with regard to the dietary guidelines have been found a home in action area 5 on safe and supportive environments for nutrition at all ages. The Decade of Action work plan also defines the means of implementations, which are, for example, commitment making and action networks. WHO and FAO also produced a resource guide to encourage more countries to make smart commitments. And here again, I want to draw attention to this resource guide, where on page 64, again, you will see reference to the recommendations of the ICN2, recommendations 13 and 16, for example, that really refer to the establishment or the adaptation of food-based dietary guidelines. So I would recommend, and you find the link on the bottom of this slide, download this commitment resource guide, because it can help you in providing inspiration to make commitments in your respective countries, which could be announced still in the frame of the Food System Summit or for the Nutrition for Growth Summit, or at any time, actually. So, of course, one of the other means of implementations are the action networks. And again, the PAHO region has been the leader in establishing regional networks. There are also a couple of global action networks, including the one on nutrition labeling, which is co-led by France, Australia, and Chile. And yes, commitments are being made. And indeed, Brazil was the first country to publicly showcase and submit their commitments. It's, of course, action that counts. And although not many other countries have followed commitments, a lot of action has happened during this time. The Decade of Action has a website, and I think you all know it, and this is just for information. Now let's go and look at the Food System Summit. In 2019, the UN Secretary General announced that he wanted to hold a Food System Summit, and he appointed a special envoy for the Food System Summit, which is Dr. Agnes Kalibata. And from the onset, the Secretary General really emphasized that this had to be a people summit and a solutions summit. And those that have been following the whole process of the Food System Summit, they might have their own opinion whether effectively this has been a people's summit. There has been a lot of publications and blogs on this, whether or not it is a people's summit, but that's not now the topic of this presentation. The Food System Summit has 5 action tracks, and each of these action tracks is led by an organization and supported by a UN anchor agency. And for action track 2 that you can see here, shift to healthy and sustainable consumption patterns, WHO was asked to be the anchor agency. Now, after the summit have been dissolved and stopped working. What have been the contributions of the... I think there's again somebody that is not muted, but anyway, I'll continue because of time. So WHO's contribution to the UN Food System Summit have been diverse. First of all, we supported Action Track 2. We supported also, and we were member of the UN Task Force. We have been producing a number of products. And most of all, we wanted to promote and ensure that health and nutrition is at the center of the Food System Summit discussions, which I'm not sure if we succeeded in that. In any case, we have developed a new narrative on food systems for health because we wanted to really show how food systems impact health through different pathways. And we identify 5 major pathways through which food systems impact health. And we have the summary of this document now available in the 6 UN languages. The full document is still under development and hopefully will be produced before the end of the year. So we try to promote a package of policy actions that you can see here through the Food System Summit. We wanted to push for fiscal policies, public food procurement, nutrition labeling, regulation of marketing of foods, food fortification, and food product reformulation. And for each of these actions, we have produced social media assets, we have produced policy briefs that you can see here, a sample of it, and that you can also download and consult on our website. Actually, we had a teaser event that we organized last week to showcase these briefs on the package of policy actions. So now what next? The Food System Summit took place last week. Lots of statements, lots of attention. There's the publication of the Secretary General's Statement of Action, and also what the Food System Summit Secretariat now has identified as 5 action areas that you can see on this slide. Nourish all people, boost nature-based solutions of production, advance equitable livelihoods, build resilience, and support means of implementation. So again, a lot of similarities with what we had identified and defined in the Decade of Action on Nutrition. So one of the outcomes of the Food Systems Summit is the establishment of coalitions. And WHO is also very much engaged in 2 of these coalitions, one on healthy school meals and the other one on healthy diets. And they both fall under the umbrella of the first action area of Nourish All People. So the Healthy Diet Coalition from Sustainable Food Systems, it has a long title, is going to, is a very large umbrella from farm to fork, focusing on a number of actions and policy actions. We invite member states, UN agencies, and non-state actors to join and support this coalition that will really focus on the food supply, on the food environment, and also on the valuing of healthy diets. Again, the food-based dietary guidelines and the establishment of them and the inclusion of, for example, sustainability measures in the dietary guidelines falls under this coalition. So we definitely encourage member states and state actors to join this Healthy Diet Coalition. So in conclusion, this action network on dietary guidelines really supports, first of all, the commitment of the ICN. It supports the UN action area number 5. It supports the action area of the Food Systems Summit. And overall, it supports the achievement of the SDG 2030 Agenda for Sustainable Development. And with this, I hope I stayed on time, Mr. Moderator. I hand back to you.
Muito obrigado, doutora Lina.
Thank you very much, Dr. Nina, for your contribution to the seminar. Now we'll have the honor of inviting Dr. Israel Rios Castillo, Nutrition Officer for Latin America and Caribbean of FAO, to talk about the Decade of Action towards Nutrition of the Organization of United Nations, the Summit on Food Systems, and the pathways for the member states to end malnutrition.
Com a palavra, senhor Israel.
Bom dia para todos. É um prazer para mim acompanhar este evento do Ministério da Saúde. Das guias
Good morning to all. It's important, it's a pleasure to be here. It's important to combat malnutrition. I will speak in Spanish now, and we will start with the presentation. I would like to make some analysis on the current situation on hunger, on SDG 2, and others, like this global commitment in terms of sustainable development as regards nutrition. So to give a little bit more of context of what the report in terms of food security has left us, and this through the UN, this is situation of food security in the world. They're using their acronyms in English. Just a second. Hunger has increased critically. Now we have 800 million people in undernutrition and an increase this year due to the pandemic. Hunger has increased a lot, and we estimated 800 million people, and this is a significant increase. Our region is part of this reality. Just in Latin America, in 2020, 14 million people got into this category of undernutrition. And just to have an idea, that's around 60 million people. And this is a critical, because this gets in the way of eradicating hunger in this region. Another indicator is food insecurity, a concern, anxiety as regards food subjects, as lack of resources. And this indicator, we estimate the two categories, the moderate and the grave. And this moderate condition there's not only the issue of anxiety, but there is a concern as regards the quality of the food. What is the quality of the food that is being offered and taken to the table? Once more, due to lack of access or resources. And besides having this concern on the quantity of food, they experience hunger due to lack of money, resources, or someone in the family doesn't eat or might go a whole day without eating at home. And these are some of the scenarios, and the experience with hunger is very close. At the world level, as regards undernutrition, food insecurity at the moderate or grave level has increased. In 3 million, in terms of Latin America, we have 267 million people that are in the moderate or severe as regards the previous period. So the impact of the year of the pandemic was adding 60 million people to food insecurity. At the serious, it's 23 million people in this, and 30 million that have been added during the pandemic year. And just remembering that undernutrition, as well as food insecurity, is this incapacity to have access to food. And this also sets other determinants like poverty, unemployment, and this is what has impacted and made that in the pandemic, almost 40% of Latin America and Caribbean is in food insecurity at moderate or severe. And this is some of the, and 14% of these in the more severe. And this is dangerous in terms of fulfilling the SDG. And the impact of the pandemic has increased critically. Other aspects that the reports talks about is healthy diets, food standards that include various foods. This is what our dietary guidelines have talked about on what is a healthy nutrition. And the report indicates that for Latin America and the Caribbean, the cost to have a healthy diet, it's $4.25, and 130 million people can okay. And the greatest cost in terms of a healthy diet, and only worse in Africa. And in terms
Ya lo habían mencionado mis colegas anteriores.
And in terms of our colleagues before, the incrementing in overweight, obesity, especially in the younger, 4 million in the Caribbean have an excess weight. In those in the school age, 20 to 40% of those in school age or teenage have overweight, and adults, 260 million are overweight, and 140 million people are obese in terms of adults, and also deficiency of micronutrients, and these also persist, and this causes problems in public health in many countries. We talk about the double or triple charge or load of malnutrition, and in terms of a current context of the pandemic, we've observed endemic issues in talking about malnutrition for children, mothers, and also in terms of climate change, which has been added to the COVID. And this has endemic effects to the more vulnerable population, indigenous people, and in those contexts of the poorest in our countries. And these have become more serious due to the incapacity, the lack of access to healthy foods, and more nutrition and diets that are more nutritive. And all of these aspects have joined, added up. And part of the report in terms of food security, that the 5 agencies of the UN, including FAO, this negative impact has happened upon these indicators in terms of malnutrition, access to healthy nutrition, all of these are negative impact. Just to highlight the relationship between malnutrition and COVID, there have become documents, analysis studies that relate the negative effects that obesity has when it infects, the patient becomes infected with COVID, and people who are obese have a greater risk of a positive result of being hospitalized, and also going to the intensive care units and needing invasive mechanical breathing, and not least important, the people with obesity and COVID have greater risk of dying. So this increases, we need a full approach so that all the determinants of what causes malnutrition and work in networks through these dietary guidelines networks and other action networks to create a space to design or to reformulate public policies as regards malnutrition, access to a healthy diet, to change the food systems, that they be more sustainable and sensitive to nutrition. And in these dietary guidelines have a fundamental role. In the 13th of September, in the summit as regards food systems, these are the 5 objectives that my colleagues spoke in detail in terms of action line number 1, which is to access to healthy nutrition that takes in care not only the production of food, but of production of healthy food, and that focus on the global priorities in terms of combating poverty, malnutrition, and all of these challenges that were being presented. To produce foods to productive systems that also have an impact and less impact on natural resources and helps access to healthy nutrition and to all people that are more vulnerable. To understand the food system, that there should be a balance between each of these elements. We talk about the approach in terms of the health sector. Where do these food come? Are they produced? What is the impact in the productive system and in terms of the environment and in using natural resources? So this systemic view in terms of the production and the consumption of food is essential. And to see what it is made up, the chain of supply, the environmental food environment, the nutrition environment, and the conducts of the consumer. And all of these requires that we should implement these dietary guidelines and what should be produced, how they should be transformed, sold, and how to ease the access to these healthy foods, and how to change the nutritional environment, and where publicity and promotion and sponsorship and the interference from the food industry is not healthy, especially in excessive sugar, political decisions like the ticketing or labeling laws, and in the terms of the conducts of the consumers, like we talked about the dietary guidelines as regards the best practices and lifestyles that should be healthy. And in precisely in that, to keep this supply chain of food and to be an incentive to produce fruit and vegetables and other foods that in our dietary guidelines, and to create these incentives for a more healthy food in many countries. And there are examples in how you can modulate this with public policies, like regulating how you have ads for kids and the consumption of non-healthy foods in public. And labeling is also important in terms of orienting the design of these public policies and the level of the consumers to empower consumers to make better options as regards food. We have the right to be informed, and it's an opportune strategy would be to have them at the front and well labeled to identify those foods that might present risk. So the implementation of these public policies of dietary guidelines are important, not only to consumers, but all of these other options of dietary guidelines and policies regard environmental food as consumers. It's necessary to orient these public policies to what these dietary guidelines are promoting, and they transform these food systems. And this transforming of these food systems with many actions, not only to orient the population or for best practices, but also to design and implement public policies oriented to greater impacts in terms of nutrition, to better efficacy, to policies in terms of changing consumer practices and tendencies, and in some cases, it's fundamental for the design of public policies for social protection, where school food, where you promote healthy nutrition with these public policies. I didn't want to finish without talking about the International Year of Fruits and Vegetables. We had a regional webinar on this, and this once more a space to promote healthy nutrition and to show the contribution that fruits and vegetables have this, not only the social and health aspects, but also economic development and environmental development. So it's sustainability in all their aspects. And in terms of this agenda. And so the International Year of Fruits and Vegetables sees the importance of promoting these food groups, but also the importance of counting with public policies that favor the production, management, and transformation and selling of these foods, especially when connected to sustainable chains of supplies in terms to combat poverty and family agriculture. So from my part, thank you for the opportunity for being able to share this in terms of dietary guidelines as regards these food systems. And it's a space to transform these food systems, especially on these, and that it would be the adoption of healthy foods and nutrition. Thank you, Israel, for your contribution to our seminar. And continuing
the seminar, we have the honor to invite Dr. Gisele Borcolini, coordinator of the Ministry of Health of Brazil, to share information on the action network on food guides based on the processing level of foods in the Americas. With the floor, Dr. Gisele. Hello, good morning to all of you who are here this morning. I'd like to start by thanking all countries present with us. We have here the countries that compose the whole action network for nutrition of the dietary guides, and this is an open network, and we count on other countries that are part of Mercosur who are supporting us and our listeners in today's meeting. And we also have the countries of the CPLP, the Portuguese-speaking countries, that Brazil has a great cooperation with them to support the elaboration of guidelines and guides. And I'd like to thank FAO. I believe there's someone with the microphone on. And I'd like to thank FAO, WHO, and PAHO Brazil, and the Brazilian Cooperation Agency, who's been supporting us in the organization of networks. As Luizetti rightfully said, we are in a decade of action of nutrition from 2016 to 2025, aiming at improving and contributing to the implementation of the 2030 agenda and the actions of the action networks and the coalitions that are debating after the summit. They contribute to accelerate the public policies in the countries, the implementation of these policies, especially in the concept of COVID that put in evidence the importance of the healthy food systems and the impact in health. Another important point is that the network aims at looking at the level of processing of the foods and as the level of this level's impact in the lifestyle population that has been recognized more and more with accumulation of scientific evidences, and has also been implemented in terms of public policies. And so we have a series of institutions present here. The first meeting of this guide network took place in 2018. It was an in-person meeting that we counted the presence of Argentina and Canada, Chile, Colombia, Costa Rica, Ecuador, Mexico, Peru, and Uruguay, and the agencies of the United Nations and civil society that culminated with elaboration of a concept note of this action network with a level of action in products, and that tomorrow at the end of the workshop we'll have the opportunity of revisiting what we have agreed upon and what we have suggested in 2018, with the objective of improving that and defining the actions of the next 4 years in this decade. And I'd like to remind you that the participation of the countries is voluntary from the representation of the Ministries of Health. So once again, it's an open network that, well, other countries are able to.
Que hoje nós temos, além dos países do Mercosul, né, Bolívia e Paraguai, que até então não fazem parte da rede, mas nós estamos em processo, né, de discussão e hoje estão aqui conosco conhecendo a proposta. Além disso, os países de língua portuguesa, né, em que o Brasil se comprometeu em apoiá-los nesse processo. Então, essa agenda desses 2 dias, né, visa discutir as últimas evidências em relação aos guias alimentares baseados em alimento, o impacto, né, do nível de processamento dos alimentos na saúde, com participação de pesquisadores nacionais, que são referências nacionais e internacionais, assim como as agências da ONU, que estão discutindo, né, todos esses temas no âmbito da década da nutrição e mais recentemente na cúpula dos sistemas alimentares. Então, a nossa ideia é, com esse encontro hoje, né, nós possamos fazer um debate sobre as evidências mais recentes em relação...
So we have the recent evidence in terms of food processing, and at the same time, for us to share experiences in the axles of monitoring of dietary guides and monitoring of them. And tomorrow we'll have the opportunity of thinking jointly about what are the main products and actions that this network may produce in the last 4 years of this decade. Once again, I'd like to thank everybody here present. I wish you all a great event. Thank you very much.